Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, and I'm going to be going over GI disturbances. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and don't forget I'm now offering next generation NCLEX reviews, one-on-one private tutoring sessions, and consultation sessions. You can reserve your spot by going to my website, nexusnursinginstitute.com. I also have something for the current nursing students. You haven't graduated yet. You are still in the program. You are struggling. You have to do really well on your next exam. Be sure to check out the audio lessons that I have available on my website, nexusnursinginstitute.com. Once again, that's nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my other social media platforms, such as TikTok, Instagram, and Facebook. My handle is the same everywhere. It's Nexus Nursing, so be sure to check that out. All right, guys, without any further ado, let's get started. GI issues. Your patient's diagnosed with appendicitis. Which signs or symptoms would indicate perforation? Would it be sudden decrease in pain? Would it be a negative Rolfing sign? Would it be a soft abdomen, or would it be hypothermia? Your patient's just been diagnosed with appendicitis. Which sign or symptom would indicate perforation? Very good. Sudden decrease in pain. So the patient who has appendicitis, they've got inflammation of the appendix, they're going to have that right lower quadrant pain. It's going to hurt really, really bad, right? All of a sudden, that pain goes away. Do you think miraculously they've been cured? No. What happened is that appendix that's been inflamed, that was causing so much pain, it's ruptured. And so all of that pressure that was building up has been released. But what does that mean? That means all of that fecal matter that was in the appendix is now in what should have been a sterile environment. So this patient's going to be at risk for peritonitis. Okay, so that sudden decrease in pain, that is a sign to let you know this patient's going to have to be rushed to the operating room. Okay, because when it comes to perforation, if that patient does not get surgery, it's not a question of if they will die, it's when, and it's going to be sooner than later. That's the correct answer. Now let's look at the wrong answer choices. A negative Rolfing sign. First of all, if the patient has appendicitis, we would expect the patient to have a positive Rolfing sign. Now, what that is, guys, that's when you palpate that anywhere in the patient's abdomen and they have pain in the right lower quadrant. That lets you know the patient most likely has appendicitis. Okay, so it wouldn't be a negative Rolfing sign. Soft abdomen, nope. If the patient's got appendicitis, they'll be guarding that area. And if that appendix has ruptured, if there's been perforation, that area is going to become rigid, board-like. And last, hypothermia. No, if anything, that patient's temperature is going to increase, especially if that appendix ruptures. So the correct answer is sudden decrease in pain. And now you know why. Next question. Your patient has pancreatitis. Which lab value would you monitor? You can come in. Here are your choices: potassium, calcium, creatinine, or amylase. Your patient has pancreatitis. Which lab value would you monitor? Potassium, calcium, creatinine, or amylase? Very good. Amylase, guys, that is a digestive enzyme. And what it does is it breaks down like complex sugars to simple sugars. Excuse me. And it's produced by the pancreas. So if the pancreas is in trouble, patient has pancreatitis, which means that pancreas is inflamed, you're going to be looking at things that the pancreas actually produces, such as those enzymes, such as amylase. So what else would you be concerned about? You'd be looking at insulin, because Where is insulin produced? In the pancreas. Remember those islet cells? What's it called? I'm saying it wrong. Islets of Langerhans. Yes. Islets of Langerhans. Where's that located? On the pancreas. So you'd be looking at amylase. Let's talk about the other choices. Potassium, you know, the normal range is 3.5 to 5. Anything outside of that normal range, you're going to be concerned about cardiac dysrhythmias. Calcium, we love calcium. Calcium makes the bone strong. When it's low in the bloodstream, the patient can have tetany, they can have muscle nerve irritation. Creatinine is specific to the kidneys, and of course amylase again, guys, is an enzyme that is produced by the pancreas and the salivary glands. What teaching would you give to a patient with hepatitis B? Would you tell them you must be treated for 90 days before you can donate blood, or eat a diet low in carbs, or take acetaminophen every 46 hours for pain, or would you tell them to rest frequently? Which teaching would you give to a patient with hepatitis B? Wow. 13 of you chose you have to be treated for 90 days before you can donate blood. And on the live, most of you guys chose that as your answer as well. Well, let me clear this up for you. Let me make this clear. Any patient who's been diagnosed with hepatitis B, they cannot donate blood ever in their life ever again. We don't want it. Okay, that wasn't nice, but you know what I mean. I'm saying this so you can remember. Don't cancel me. Any patient who's been diagnosed with hepatitis B can never donate blood. So it doesn't matter that they've been treated for 90 days. They can never donate blood. So that's wrong. Next choice, eat a diet low in carbs. No, we want the patient to eat a diet high in carbs. This patient with hepatitis B, this is a viral infection. The patient's going to be losing weight. And guess what? Carbs give you energy. You need energy to fight the infection. So we're going to tell the patient to eat a diet high in carbs. We don't want them wasting away. And the next choice, take acetaminophen every 4 to 6 hours. Well, here's the thing about acetaminophen. By the way, acetaminophen is Tylenol, guys. Acetaminophen is hepatotoxic. It messes with the liver, right? Patients already got hepatitis, which affects the liver. You think we want to give them anything that will hurt the liver even more? No. The correct answer is rest frequently. This patient's going to need lots of rest. Thank you, guys. I see you on the live. Thank you. Your patient's experiencing biliary colic associated with cholecystitis. What should be part of your teaching plan? Would it be to eat foods high in protein? Would it be to eat foods high in fiber? Would it be to avoid foods high in sodium? Or would it be to avoid foods high in fat? Your patient's experiencing biliary colic that's associated with cholecystitis. What are you going to teach them? Very good. Avoid foods high in fat. Why? All right, patients got biliary colic. This is very painful, by the way. They've got biliary colic and it's associated with cholecystitis. So that gallbladder is inflamed. What are we going to want to do? We're going to want to rest the gallbladder, right? So you're going to teach them to eat, to avoid foods that are high in fat, because the more fat that you eat, the more bile that's going to be released from the gallbladder. We don't want that gallbladder working. We want the gallbladder to rest. So we're going to tell them to stay away from foods high in fat. Now let's look at the wrong answer choices. Eat foods high in protein. that's not associated with the gallbladder. If the patient, had a wound, because remember, protein's good for wound healing, protein's good for, muscles, something like that. But this is the gallbladder we're talking about. Next, avoid foods high in sodium. We would say that to a patient who maybe they're in fluid overload, they're holding on to too much fluid, they've got congestive heart failure, they've got hypertension, right? Where we want them to lower sodium, because fluid follows sodium. So when you lower the sodium, you lower the fluid. So someone like that, you would tell them to avoid foods high in sodium, but sodium really isn't associated with inflammation of the gallbladder. But guess what? Foods high in fat absolutely is. And that's why that's your answer. Your patient's diagnosed with diverticular disease. Where would you expect your patient to experience pain? Would it be the right upper quadrant? Would it be the right lower quadrant? Would it be the left upper quadrant? Or would it be the left lower quadrant? Which quadrant would you expect your patient to have pain if they had diverticular disease? All right, very good. Left lower quadrant. So that patient with diverticular disease, I want you to think about it. The reason, by the way, that left lower quadrant, that's where the sigmoid colon would be. The reason why we would expect to see the diverticular in that area, that's where the pressure is going to be the highest to move that fecal matter out of that area and into the rectum. So because of all that pressure, you would expect most likely the outpouchings to be there, and that would be the diverticular that we're talking about. So that's the reason why you'd expect the diverticular to be in the sigmoid colon, which is in the left lower quadrant. Your patient has iron deficiency anemia. Which foods would you encourage in the diet? Would it be grapefruit? Would it be nuts? Would it be yogurt? Or would it be red meat? Lee, thank you for sharing the live. Thank you. That's right, red meat. Red meat, and if we want to be specific, what's even higher in iron when it comes to meat? Organ meats, right? Like the kidneys, the liver, organ meat. But yes, red meat is high in iron. Iron is important for the development of RBCs. RBCs carry hemoglobin, right? Hemoglobin carries the oxygen. So iron is very important. Let's talk about the other choices. Grapefruit. Grapefruit is high in vitamin C. Nuts, that's high in protein. Yogurt, that's high in calcium. But when we're talking about iron, we're actually talking about red meat. Red meat's very high in iron. Your patient's diagnosed with GERD, that's gastroesophageal reflux disease. Which foods would you teach this patient to avoid? Chocolate, bananas, organ meats, or any types of nuts. Your patient is diagnosed with GERD. Which foods would you teach this patient to avoid? Chocolate, bananas, organ meats, or any types of nuts? That's right, chocolate. So here's a problem with gastroesophageal reflux disease. Usually let me tell you what the problem is first. Well, the problem is you have the gastric contents that are supposed to be in the stomach. It's creeping up to the esophagus. So whatever's in the stomach, the food and the hydrochloric acid that's supposed to be breaking down the food, it's supposed to be in the stomach. But guess what? It's crawling up to the esophagus. Okay. And so usually what happens, that cardiac sphincter, that sphincter that's supposed to remain closed so that the gastric contents can stay in the stomach, is loose. And so the things that are in the stomach, such as the food and the hydrochloric acid, creep up into the esophagus, and it causes that burning sensation. So you're going to teach the patient to stay away from foods that can lower the pressure on that cardiac sphincter. Foods such as coffee, chocolate, peppermint, licorice, fried foods, right? Anything that will decrease the pressure on that sphincter, you're going to teach the patient to stay away from. I know we love our chocolate. Okay, type in your answer. Which your patient is diagnosed with cholelithiasis. Which organ is affected? Type in your answer. Your patient is diagnosed with cholelithiasis. When you see cholelithiasis, which organ is being affected? Type your answer in. I see stomach, gallbladder, colon. It's the gallbladder. So cholelithiasis, that's when the patient has gallstones. Cholecystitis is when that the gallbladder is inflamed. There's inflammation. So the correct answer, the organ, is the gallbladder. All right, drop pin. Which is the best position for a parentesis procedure? Click on the correct position. Would it be supine, flat on their back, prone on their tummy, Fowler's sitting up, or Sims position, they're on their side? Patient has to have a parentesis. What position is best to position that patient? Oh my gosh, I'm so happy I added this question. The correct answer, guys, is Fowler's position. If we're going to be specific, it's going to be high Fowler's. I couldn't find the high Fowler's, so that's why I just chose the Fowler's. But excuse me, it's going to be high Fowler's. So this procedure, the paracentesis, this can be used as a diagnostic procedure where we want to take out fluid in the peritoneal cavity and test it, right? And it also can be used just to drain fluid from the peritoneal cavity. But the best position is having the patient in the high Fowler's position, having them sit all the way up. So, and here's the thing, guys, NCLEX isn't perfect. Sometimes they're not going to give you the most perfect answer, and you have to choose the best answer out of your choices. And out of these choices, guys, the only one that comes close to it is going to be your Fowler's position. Your patient's taking betamethasone for arthritis. What should be a part of your teaching? Would it be to take this medication on an empty stomach? Would it be to take this medication with ascorbic acid? Would it be to take this medication with meals, or would you teach the patient to take the medication between meals? That's right. Take with meals. You need to know this medication. This medication is a steroid. There are 4 things you need to know about steroids. I don't care what kind of steroid we're talking about. If it's a steroid, the minute you see the patients on a steroid, these are the 4 things that need to be going on in the back of your mind before you're even looking for your answer choice. What are they? Hyperglycemia. Steroids increase the patient's blood sugar. So especially if this patient's a diabetic, we got to be careful. We got to be checking the blood sugar. Next, infection. Remember, steroids decrease inflammation so they can mask the signs and symptoms of infection. So you better be watching this patient a lot more closely. You're going to be checking the temperature. You're going to be looking at the WBCs. You're going to be looking at the CRP. You're going to be looking at the ESR. You're going to be looking for any signs and symptoms of infection. All right, so I told you glucose and I told you infection. What are the other two? What are the other two? Oh, number 3, ulcers. Steroids are very hard on the stomach, okay? Very hard on the stomach. It can give the patient an ulcer. That ulcer starts to bleed. Now you got another set of problems on your hands. And so that's why you teach the patient to take it with foods. If it's a steroid, they always have to take it with food because it's very hard on the stomach. We don't want that patient to get an ulcer. So that was 3. What is the 4th? What is the fourth? Guys, help me on the live. I don't remember what the fourth is. Okay, we have infection. We have glucose. We have, ulcer. I remember what the fourth is. The fourth is osteoporosis. Steroids, excuse me, tend to make the bones very porous. So you have to teach the patient to be very careful, be safe, especially, excuse me, guys, I'm sorry. If it's an older patient, we're going to be concerned about osteoporosis. Don't forget those risk factors for osteoporosis. Being female, having a small frame, being postmenopausal, estrogen levels being down, all of those are risk factors for osteoporosis. But being on steroids is also a risk factor because it makes your bone porous. So you need to think of those four things when it comes to steroids. Select all that applies. Your patient's experiencing an acute episode of gastritis. What is going to be part of your teaching for this type of patient? And here are your choices. You're going to teach them to avoid milk, to take NSAIDs for the pain, to drink 30 ounces of red wine, to avoid any form of alcohol, to drink milk, to avoid spicy foods. Your patient has an acute episode of gastritis. What are you going to teach them? This is a select all that applies. There's more than one answer. Oh, wow. All right. So let's talk about the correct answer. The correct answer is avoid any form of alcohol, to drink milk, which not many of you guys chose. We actually do want them to drink milk, and avoid spicy foods. Why? Okay, let's talk about this. So your patient has an acute episode of gastritis. What is gastritis? Gastro, stomach, itis, inflammation of. So it's inflammation of that inner lining of the stomach, right? So this patient who's having inflammation of that lining of their stomach, the reason we want them to avoid alcohol is we always want patients to avoid alcohol. Alcohol is never good, okay? Don't ever tell the patient to drink alcohol. That's never going to be your answer. I'll tell you that right now. And alcohol makes things worse anyway. Drink milk. Why do we want the patient to drink with milk? I want you to think about it. What do we know about milk? We know that milk increases mucus production. And usually that's a bad thing. But when it comes to gastritis, that's a good thing because this patient's stomach lining is already inflamed. So that mucus production will decrease the symptoms because it's what? It's causing a coating, a lining of that inflamed stomach, right? So that actually decreases the patient's symptoms. So in the case of gastritis, we actually do want them to drink milk. And last, avoid spicy foods. I think this speaks for itself. If something spicy, it's going to be irritating to the gastric lining. This patient's stomach lining is already inflamed. You think they want something to be irritating? Absolutely not. So that's why those are our correct answer choices. Now let's talk about the wrong answer choices. We know why avoid milk was wrong because we want them to drink milk. Let's talk about NSAIDs. Take NSAIDs for pain. The reason that's wrong is because NSAIDs are hard on the stomach. When a patient takes NSAIDs, that increases their risk of stomach ulcers. That's why you never give NSAIDs on an empty stomach. If a patient has to get NSAIDs, you're going to give it with food. So if the patient's already experiencing gastritis, why would we give them something that can cause them to have a stomach ulcer when that lining's already inflamed? That's a no-no. So that's why that's not the answer. And you guys already know we're not going to tell that patient to drink 30 ounces of red wine. Stop it. So now you guys know about acute gastritis. Let's move on. Your patient has GI bleeding. What is your priority nursing intervention? Is it to check the blood pressure, give antihypertensive medications as ordered, test the stool for blood, or test the emesis for blood? Your patient has GI bleeding. What are you going to do? Very good. Check the blood pressure. Let me tell you something. Whenever you see a test question that asks you what you're going to do next, and you're not sure, you're between two answers, right? Choose the answer that actually helps your patient. It will actually do something for you. Here's what I mean. Your patient's bleeding out. They're hemorrhaging. Us checking the blood pressure, that's going to tell us a lot, and it's going to help us with our next nursing intervention, right? If that patient's bleeding out, we don't want them going into shock. We need to make sure they're not going into shock. One of the things we're going to do is check that blood pressure, okay? Because guess what? That blood pressure is going down. That the patient may need what? Vasopressors or something else, but we're not going to know unless we do what? Check the patient's blood pressure. Let's look at the other choices so you can see why they're wrong. Next, I'm happy no one chose that. Give an antihypertensive medication. You know what? I'm very proud of you because I tacked on as ordered to trick you, to make you think that just because it was ordered, you should give it. And in nursing, we never give a medication just because it's ordered. Because at the end of the day, if that patient's harmed, let me tell you something. I'm telling you this right now. The healthcare provider, that ordering physician or nurse practitioner or physician assistant, they will drop kick you under the bus. Okay? You are not a robot. It has to make sense. So if that patient's losing blood, which we would expect that blood pressure to go down, why would we make it even worse by giving an antihypertensive medication? Absolutely not. We would withhold that medication and place a call to the healthcare provider, letting them know why. And if they tell you still give it anyway, you tell them to come give it to the medication because you're not going to lose your license. Testing the stool for blood and testing the emesis for blood, those are great nursing interventions, but that comes after the priority, which is checking that blood pressure. All right. All right, type in your answer. This is the last question. Your patient has pernicious anemia. Which vitamin is deficient in pernicious anemia? Type in your answer. In pernicious anemia, which vitamin is deficient? Which vitamin is low? You guys are doing great on the live. You're killing me, Stacy. Let's see what you said. B12, D, gallbladder. I said vitamin. Yes, cobalamin, vitamin B12. So the patient that has pernicious anemia, guys, what's happening is they don't have intrinsic factor, and intrinsic factor is what's needed to absorb vitamin B12. Vitamin B12 is important for the neurological status, okay? Let me tell you something. You cannot live without vitamin B12. So if you have pernicious anemia and you are not getting an exogenous source, that means an outside source of vitamin B12, you're not going to live long. All right. So let's talk about this. You don't have vitamin B12 because you're not absorbing it because you don't have intrinsic factor. Where's intrinsic factor found? It's found in the gut, in the stomach. So patients who's had, what's that surgery where they cut out part of your stomach? Guys, what's the surgery called when they cut out part of your stomach? I'm having such a brain fart right now. You know what I'm talking about on TLC. They have Dr. Now. Thank you, gastric bypass. So patients who had a procedure such as gastric bypass, where a portion of the stomach has been removed, guess what? They may not have intrinsic factor anymore, which means they cannot absorb vitamin B12 anymore, which means they are going to have to get an exogenous, an outside source of vitamin B12. And here's how it goes. They can't get it by mouth, because if you get a medication by mouth, it's a pill or a tablet. It has to be absorbed in the stomach. Remember, they don't have intrinsic factor in the stomach. So the only way they get it, how, is going to be IM. They're going to get it every month intramuscularly, okay? And remember, vitamin B12 is important for the neurological system. All right? And that is the end of this Kahoot. So let's see how you guys did.